You see, the biggest problem with health insurance is not the HMO. It's how people use it. Some people use it as if they're trying to finish their money before December. Let me gist you. One woman I met in a hospital in Abuja came with her 2 children. She stormed the front desk and was yelling, "How can you tell me that I cannot use my health insurance for checkup? After my husband company house pay for it." The front desk was calm and she asked, "Okay, are you feeling sick or any of your children feeling sick?" She said, "No." "Are you uncomfortable?" She said, "No." "Okay, what do you want to check?" She said, "Everything." At that point, the whole reception was so calm and quiet. Even the clock stopped ticking. Now I understand her frustration because nobody ever explained this part properly. You pay for something and when you want to use it, they say no. It feels like a scam, right? But it's not, and I will explain why. Welcome to another episode of Chris Health Insurance Guide. I'm Chris, and I'm here to wipe out all your health insurance confusion. And today, I will show you how to use your health insurance plan like a pro. Because this simple decision can be the difference between "this plan is useless" and "wow, this plan saved me." Health insurance is not your personal money waiting for you. It's a pooled fund. Everybody contributes. Whoever falls sick first uses it. Think of it like contribution. But instead of giving one person cash, the money is used to pay everyone's hospital bills. If you're healthy, your contribution is helping another person get surgery or managing diabetes. If everybody decides to use their health plan for random tests or checkups, the money finishes fast, and when somebody actually needs care, there's nothing left. That is why HMOs controls when and how you use your health benefits. They are not being wicked. They are just protecting you from yourself. Here's how to use your health insurance plan like a pro. Time your checkups. Do your general checkups close to your renewal time. That way you stay covered without wasting your annual limit too early. If you're managing a condition, don't visit the hospital for fun. Ask for longer drug refill and only visit the hospital when necessary. Because you see that regular consultation and test, it can wipe out your medical limit in a very short time. Avoid premium hospital unless you truly need it. Because some of these hospitals will bill you 5,000 naira for paracetamol. Your HMO will pay, but it is coming from your annual limit. Always ask and sign your encounter form. That's your receipt. It helps you track what the hospital is billing your HMO for. Take advantage of preventive benefits. Some HMO cover things like vaccination, fitness program, or health talk. Use them. So health insurance is not about using it every week. It's about using it smartly. And the goal is not to spend the whole money. The goal is to stay healthy enough not to need it. So if you found this video helpful, hit the subscribe button, like and share with someone that needs to hear it, so we can all stay healthy and smart.